So the sixth and final question is, how are you going to address and solve the issue of long waiting lists for services, in particular with CAMS and other mental health services for young people?
Excellent, thank you for that, Scarlett. And we'll start with Jeremy Davies from Gwynedd, please.
I think as the economy deteriorates, we're seeing more people with anxiety, mental health arising, and it's ensuring that we can spot these signs. So I think even within schools, teachers, nurses and doctors, we need to have the training so that they can spot it when it happens. Then the psychiatrists and the psychologists come into it. But I think there's a lot that we can do also within communities. It's that getting out and just encouraging people, trying to restore that confidence, even if it's within gardening groups, within conservation groups, identifying what's there. What they're looking on a screen, I don't know. We've got to find, but I think a community, yet again, we're relying a lot on the voluntary, but those are the people who can do support. Most of us, I'm retired, I'm going back into politics, but we all need to do so. We can all do something to help. And I think we've got to go back as situation worsens within our country, the economy worsens, then it's up to us to come out, because bringing young people out, sharing, giving them that opportunity, restoring that faith and that confidence within some who are suffering from mental health or anxiety takes a lot of time.
30 seconds.
Oh, sorry. So it would be community work that I would encourage.
Diolch yn fawr iawn. Thank you for that. Very much appreciated. Next, Monty Kennard, Independent, please.
So I think that long waiting lists aren't necessarily just a capacity issue, and they reflect deeper problems with how the system works. I think that CAMS has let many young people down with inconsistent support, unsuitable provision in some cases, and quite poor transitions into adult services. And I think that needs to be acknowledged in order for it to be fixed. One of the biggest issues is that not everyone referred to CAMS actually needs specialist care. There are young people with serious mental health conditions who absolutely need that level of support, but there are also many dealing with stress, low mood, and difficult life circumstances. And those situations often need earlier practical support through schools, primary care, and improvements to day-to-day living conditions, not necessarily a referral into an already overstretched specialist service. We also need to fix how services operate. Too often there's poor communication between GPs, CAMS, and other professionals, and paper-based systems still that slow everything down, and high staff turnover, meaning that histories aren't properly understood. This leads to delays and repetition and frustration for families. Finally, I think we need to be realistic about outcomes. If a young person's mental health is being affected by poverty, housing, or lack of opportunity, services alone won't fix that. Wider action to improve quality of life has to be part of that solution. The focus should be clearer pathways, better early support, properly functioning services, and honesty about what different parts of the system can and can't do. Thank you.
Thank you very much indeed. Can we have Sian Gwenllian from Plaid Cymru, please?
Thanks for this question. 55% of young people aged 16 to 25 approach their GP with mental health concerns. That shows you the extent of the problem that we have, and we don't talk about it enough. I think we have to look at two aspects. Firstly, the preventative aspect. It is really important that young people, children, from early ages are taught resilience and healthy relationships, so that we can really focus on the prevention. But of course, crises do happen regrettably all too often. there should be a no wrong door model. Too many young people are fobbed off from one specialist to the other, from hospital to GP and back and forth. There should be no wrong door model. That's crucial. And there should also be closer integration between the CAMS and the adult mental health, because often there's a cliff edge at 18, and we have to strive to avoid that. There are new mental health hubs that came into being through the work that Plaid Cymru did in this last Senedd term, and I think having those mental health hubs continue and expand, that also is a really a good way forward. And we've also said that we would protect the mental health spending, i.e. it would be ring fenced within the next government. Thank you.
Diolch yn fawr iawn, thank you, Sian. Last but not least on this question, Alan Davies, Conservatives.
Thank you, and thanks, Scarlett, for the question again. Mental health issues have gone further up the agenda in recent years, but the services to support people have not. We must transform mental health within Wales. We've got to increase the spending on mental health and well-being services in real terms in each of and every year of the next Senedd. Establish a number of mental health crisis centres across Wales that are open 24/7, because all too often a crisis happens on a Friday night after office hours. So a centre must be available for 24/7 to deal with any crisis that a young person might have. We also must publish mental health waiting times and other performance data, because there's quite a variation across the different areas within Wales. And it's important that we increase the capacity of mental health services for children and young people. You mentioned CAMS before, but it's really important that we address these issues early and make sure that children do not have to travel too great a distance from their homes and their loved ones. And one final thing, we must establish a dedicated mother and toddler unit in North Wales for those with severe postnatal
30 seconds.
Mental health challenges. It is really, for new mums, it can be a really lonely and really tough place to be. So we must make sure the services for them are really good to ensure that their child has a best start. Thank you.